Okay, so today I'm going to be going over oral cares for a ventilated patient. So the first thing that I'm going to do when I enter the room is I'm going to wash my hands and I'm going to put on my gloves. And then the next thing that I'm kind of going to do is get my suction hooked up. So you'll have your wall suction with your suction tubing. And then if you open up the first kit here, it's kind of torn up. There will be a little adapter that you can hook into your suction, and then you have a Y piece so you can have a couple different suction tubes going at the same time. And then we have this fancy little thing that you're going to hook into your suction tubing, and then you're going to connect this. So this kind of just goes over your suction so it keeps it clean, so it's not just like laying on the bed. So, you can suction your patient and get all of their kind of secretions and stuff out of their mouth. And then I'll start with my actual oral cares. So this one I have open here is the one with the toothbrush. And so you can take the suction off and then attach the toothbrush setting. And it has, so then you can suction through the toothbrush. I'm going to leave the suction off and use the little package of like toothpaste that they've got and put that on and then kind of just go through the patient's mouth, cleaning their teeth, making sure to get the gums and all the way back to their molars. And then once I'm done with that, then I'll turn the suction on and then kind of go over their teeth again. But if you turn the suction on right away, then you're just going to suck up all the toothpaste that you just put on there. So then I'll do that. And then try that out. This can get thrown away. And then I will hook up, I have my little green sponge here, and the mouth moisturizer. So I'll put my mouth moisturizer kind of all over this and then just go through my patient's mouth, just making sure that I get everything nice and moisturized so they don't have that dry mouth, making sure that I'm still suctioning in between the moisturizer and the toothbrush kind of as I need, and suction as you go along. And then you wait 2 hours and then come back and you can pull your next kit out and suction your patient, and then grab the next one and it's some more swabs. So these ones are the suction swabs. So then it comes with this little, I don't know, it's kind of like a toothpaste again. I don't know if you can really see that. And so again, I just trade this out and put this one on. I'll dip this in the solution, go through my patient's mouth very gently, making sure that I'm getting their cheeks and their molars and their tongue, and then turn my suction on and then suction while I'm in there. And then same thing, trade it out, suction out their mouth, rinse out their mouth as we need, and then get my little swab and my moisturizer and then moisturize their mouth again so that their mouth isn't getting dry. And then we're doing all of this to kind of prevent ventilator-associated pneumonia, so we're keeping their mouth nice and clean so bacteria and stuff isn't growing in there. So then 2 hours later, come back, and the next oral cares kit that I have is this little suction catheter. So again, grab this, suction out their mouth, and then I can trade this out for this one, where we can kind of suction deeper down into their throat, of course keeping it clean, and we don't want to be rubbing this all over the patient, so keeping this as clean and sterile as I can, and suctioning out the patient's mouth. And then you always want to make sure that, again, you're moisturizing their mouth once you're done. And then put this back on and suction them again. And then just keep making sure that that's happening every 2 hours and keeping their mouth clean.